All right, so what measures are you taking to manage your expenses in this recession? Do share with us on Twitter at Gist Nigeria TV. Moving on to our next story for today. Now, how would you rate your oral hygiene techniques? The foundation for good dental hygiene is brushing your teeth, but there is so much more. Experts say proper dental care will help stop problems with our teeth before they develop. So, are you doing it right? Abayomi Adisa tells us more.
One of the earliest things we learned as children was brushing our teeth and taking care of our oral hygiene. But what seems simple may not be as simple. Until recently, when I visited a dentist, I realized that these simple skills had perhaps been learned wrongly, not just by me, but by many others. And who knows, you may just be as wrong as I. Let's start with the most basic of all. How often do you brush your teeth a day?
I brush once a day. Usually once a day.
Well, my answers used to be exactly as theirs. But Dr. Onikosi, a dentist, has a different view.
We recommend our patients to brush our teeth twice a day. The best time to brush the teeth is after breakfast, then before you sleep at night. I understand that some patients, they don't eat breakfast in the morning. That's fine. If you are that kind of person, you can brush your teeth in the morning.
Oh well, one down, many more to check. Now, how do you brush your teeth?
Up and down, sometimes sideways, just to cover the corners of the teeth.
From my side, upstairs, downstairs, and my tongue.
Up, down, then the inner parts, scrub it out.
There are different kind of techniques to brush your teeth, but the most widely taught and easy to learn technique is called the wrist roll technique. So now your toothbrush is pointing horizontally to the buccal surface of your teeth. Then you roll your wrists, bringing the dirt down. You can see the bristles are also entering into your interdental area, that's in between your teeth. The same thing applies to your lower jaw. Then if you notice, the anatomy of the anterior teeth are different from the anatomy of the posterior teeth. So you brush the surface, the occlusal surfaces of the posterior teeth. So for people that don't follow a particular technique, that just brush their teeth based on how they want to brush it, you are basically just spreading the dirt all over your teeth. You are not removing the dirt.
Another simple thing that, well, requires tact is how you rinse your mouth after brushing.
I goggle a lot. Try to rinse as much as possible to get the paste off.
Again, the doctor says we are wrong.
The ideal thing to do is not to rinse your mouth after brushing your teeth, because we want the fluoride contained in your toothpaste to remain on your teeth. The reason why we want that is because we know that nobody is 100% efficient in cleaning their mouth, so there will still be a little bit of bacteria remaining on your teeth. So we want the fluoride that is remaining, we want the fluoride to prevent that bacteria from making use of sugary substrate you take.
Well, next on my checklist is our choice of toothbrushes. What do you consider when buying toothbrushes? For me, I like it soft and nice, but is that all to it?
A soft bristle toothbrush will not clean your permanent teeth efficiently enough. It will not clean properly. There will be a lot of bacteria accumulating, forming plaque. A hard bristle toothbrush, first of all, would damage your gum. So the best form of toothbrush is the medium bristle toothbrush.
If my choice of toothbrush was wrong, I couldn't have got my paste wrong. For optimal care, I prefer to buy imported toothpaste off the shelves.
Whenever you are buying a toothpaste, make sure it contains fluoride. You can check behind the pack for the constituent of the toothpaste. Does it contain fluoride? Yes.
If there's so much to learn about brushing the teeth, how about the choice of chewing sticks, charcoal, and other traditional options preferred by some?
There are several researches and tests and investigations have been done, and that's proven that chewing stick is actually good.
Chewing stick is okay, but a bit of toothpaste makes it even better. Now, let's shift focus to other habits. For some of us, we pick our teeth after meals. Could we be doing anything wrong?
No. Don't use toothpick at all. Avoid toothpick by all means. The best thing advised for you to use is a floss. Take your floss, put it in between your teeth like this. By doing this, it is pushing the bacteria.
Since our mouth is the gateway to our heart and perhaps our overall well-being, it's time to assess how well we care for it. Abayomi Adisa, Gist Nigeria.
Some useful tips there. There's more to come here on Gist Nigeria from the BBC and Channels TV. She is using nails and colored threads to make artworks that inspire women and drive conversations about climate change. That story and more is right after this break. Stay with us.